days ago, this man suffered a stroke. It has severely impaired him, limiting the use of his right leg and right hand. The sudden blockage of a blood vessel, potentially leaving a person paralyzed or even leading to death.
It really doesn't move like I'd like it to.
Stroke. In this program, we will discuss with leading medical experts in their respective fields regarding the most advanced medical procedures available in Japan. In this episode, we are joined by Dr. Kazuo Minamatsu, the Emeritus Director General of the National Cerebral and Cardiovascular Center. Dr. Minamatsu has been involved in the treatment and research of stroke for approximately 40 years. Ask the doctor. Approximately 1/3 of strokes are thought to be caused by blood clots, which occur at the heart, creating a blockage. These strokes, which are caused at the heart, are known as knockout strokes. The medical term is cardiogenic cerebroembolism. Compared to strokes caused by hardening of the arteries, it is thought that this type of stroke is associated with greater severity and a higher mortality rate.
Dr. Minamatsu, this means that among strokes, the one caused at the heart are especially dangerous?
Yes, this type of stroke is associated with higher severity and a higher mortality rate. This is why doctors refer to this condition as knockout stroke. As far as this condition is concerned, most people are not familiar with it. Therefore, we're actively promoting the prevention of this type of stroke by raising awareness.
Cerebral infarction occurs when blood clots are formed, blocking the flow of blood in a blood vessel. Here we have rare footage of the moment when a blood vessel gets blocked by a blood clot.
This footage was acquired using an 8K ultra-high-definition microscopic camera. The red color seen in this video is the blood which is flowing through the blood vessel. Each of these pellets are actually red blood cells. And these shown on the screen are platelets, the cause of blood clots. When the platelets accumulate, a large cluster forms. This is a blood clot. The blood clot drifts as it is carried by the bloodstream. From the bottom left, the blood clot is carried along the blood vessel. And as the artery narrows, it gets blocked.
The moment that a blood vessel becomes blocked. I've never seen this before. The blood clot is blocking a blood vessel in the brain. So is that a stroke?
Yes. The clot itself is created in order to repair damage which is caused by the hardening of the arteries. Actually, there are situations where the hardening of the arteries advances further and the blood vessels become narrower. A blood clot like the one shown earlier would be carried further down the blood vessel, blocking the blood flow and causing a stroke. The scariest of strokes resulting from this mechanism is termed a cardiogenic cerebral embolism.
Cardiogenic cerebral embolisms are caused by atrial fibrillations, a form of arrhythmia.
Atrial fibrillations are a form of arrhythmia, which causes small vibrations within a chamber of the heart. In a situation in which small vibrations occur, the blood stagnates and easily hardens, possibly forming blood clots. If the blood clot formed in that chamber flows out of the heart and is carried to the brain, a blood vessel in the brain may be blocked, causing cerebral infarction. Here, a blood clot is formed in the heart. Compared to a blood clot formed in a blood vessel, this type of clot is often much larger, if somehow the clot is dislodged and flows into the body. In the arteries within the brain, these clots can cause blockages within relatively large blood vessels, so an extremely wide-scale infarction may occur, a truly terrifying condition. This is a CT image from an actual patient.
The dark section is quite spread out. Has this section undergone necrosis?
Yes, this shows that the blood vessels at the base got blocked, exerting a massive effect. The condition itself is varied, and depending on the circumstances, it may be fatal. Even if the victim survives, there may be serious complications, leaving the individual bedridden or requiring extensive assistance. A definite possibility with this condition. The mortality rate of stroke is thought to be 5%. Recently, the chances of survival have increased favorably. However, with this condition, the mortality rate is much higher, with approximately 1 in 7 or 8 patients losing their life. Of the survivors, more than half require assistance or remain bedridden. Avoiding such a situation is currently our biggest mission.
Next, we will hear about prevention. Ask the doctor.
Approximately 80 to 90% of cardiogenic cerebral embolism cases are caused by atrial fibrillation, a form of arrhythmia. Therefore, identifying this condition at an early stage is the most effective form of prevention.
Is there a way to check for atrial fibrillation on your own?
Since this is a form of arrhythmia, the best place to start would be to measure your pulse. The most common method to measure your pulse is at your wrist. Well, if you can put out both hands, one hand is enough. I use my left. Now take the palm of your hand facing upward or toward yourself, and you'll end up with some wrinkles here. That position close to your thumb. At this position, apply your forefinger, middle finger, and ring finger to locate the pulse. If locating the pulse is challenging, move your finger slightly. Put your fingers somewhat perpendicular. That should help. You should be able to feel your pulse. Can you feel it?
It's a little difficult to find. Once you find it, it is easy to identify.
Measure the pulse for approximately 30 seconds. Feel the rhythm. For me, it is a pretty regular thump, 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 thump. I think the speed of the pulse depends on the individual. In this case, there is no problem, but in the case of atrial fibrillation, you may get an irregular pulse like thump, 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 thump. But if you felt that your pulse was irregular, you should discuss this with a physician. An ECG examination would tell you. Also, arrhythmia and atrial fibrillation occasionally disappear. If there are no pulse irregularities, repeat the measurement at a later time. This way, you might detect an irregular pulse.
Which individuals should show extra care when checking such things?
Well, people who have a background of hardened arteries and the elderly are at a higher risk of arrhythmia and atrial fibrillation. People over 65, those with lifestyle problems and high blood pressure, and those with identifiable symptoms. A sudden sense of panic or shortness of breath after climbing a flight of stairs. Actual chest pains. These symptoms alone would warrant a visit to the doctor. If you have such identifiable symptoms, you should be measuring your pulse on a more regular basis. If this is performed, the chances of finding atrial fibrillation would be much greater. Other than this, strokes may also be caused by the hardening of arteries. These are termed lacunar infarction and atherothrombotic infarction. Characteristically, lacunar infarctions block thin blood vessels, while atherothrombotic infarctions block larger blood vessels. Depending on the location of the infarction, each stroke may be minor or serious, with various symptoms. The treatment and prevention of stroke continue to advance. Please take the appropriate measures for the prevention of stroke.
Dr. Minimatsu, thank you for joining us today.